Hi, JD. Can you verify your last name and date of birth? Perfect. I'm going to go over medications before we discharge you. While you were here, we continued to give you your Synthroid and your Protonics. We have added 3 new medications to treat your high blood pressure and diabetes, which are low pressor, Zestro, and Metformin. I'm going to go over each of these one by one with you and your wife. You have been taking Synthroid or levothyroxine prior to being admitted. This is your hypothyroid medication and it increases the amount of thyroid hormone in your body. Nothing will change in the way you take this medication. There usually aren't a lot of side effects with this medication unless your levels are too high or too low. So continue to take this first thing in the morning on an empty stomach, so take it before breakfast and at the same time each day. Continue to have your thyroid levels checked, and note that if you become anxious, have weight loss, increased sweating, nausea, vomiting, and or intolerance to heat, you need to contact your doctor immediately, as that can be a sign that your thyroid level is too high. You have also been taking Protonics or pantoprazole for your GERD. This medication reduces the amount of acid in your stomach. The main side effect with this can include abdominal pain, GI irritation, and electrolyte imbalances. You should monitor your bowel functions for diarrhea, cramping, fever, and bloody stools. If any of this happens, you need to contact your primary care doctor. Continue to take this medication in the morning before you eat as well. Your doctor may want to monitor your liver functions and electrolytes through blood work. Try to avoid drinking alcohol and taking any other medications with aspirin or NSAIDs and foods that upset your stomach. If you have an onset of black and tarry stools, you should contact your primary care physician immediately. The first new medication you will see is low pressor or metoprolol. This medication is for your high blood pressure and blocks your fight or flight hormones, which will then decrease how hard your heart has to work and therefore lowers your blood pressure. Because of how it works, it can cause low pulse or heart rate, and it can also cause your blood pressure to become too low. This can cause lightheadedness, dizziness, etc. Unfortunately, it can also cause low blood sugar. So those symptoms can mask the low blood pressure or low blood sugar. Erectile dysfunction is also a side effect, and fatigue and weakness. So with that being said, you should check your blood pressure and pulse to ensure they are within normal limits. And you should also contact your primary care physician if they are not. Keep in mind to stand up slowly and to change positions slowly as well to avoid lightheadedness and dizziness. Due to your new diagnosis of diabetes, it is important to monitor your blood sugar regularly, but with the start of this medication, you're going to want to check it more frequently to avoid drops in sugar. If you start to become sweaty, check your sugar immediately, as this could be the one and only sign that doesn't necessarily get masked by this medicine. Do not stop taking this medication suddenly. If you miss a dose, you can take it as soon as possible, but do not take it within 8 hours of the next dose. Zestro or lisinopril is another new medication for your high blood pressure. This one works differently than the metoprolol because it stops the vasoconstriction or squeezing of your blood vessels that happens when your blood pressure is too high. Therefore, it relaxes your blood vessels and then lowers your blood pressure. The most common side effect is a dry cough. Hard candy and drinks can help with this. You can also experience a drop in blood pressure when you stand, dizziness, and elevated potassium levels. Again, be mindful when you stand or change positions quickly. But The most concerning side effect that can occur with this medication is what's called angioedema. Angioedema is a rapid swelling of deep tissues, and it most often affects your face, lips, throat, and tongue. If you notice any swelling or even itchiness or tingling of those areas, you need to report to the closest immediate or emergency room immediately, because it can be life-threatening. Again, take this medication as prescribed at the same time every day. Do not stop taking it abruptly. And with this, because it can elevate your potassium levels, you should avoid foods that are high in potassium. Bananas, oranges, potatoes, tomatoes, leafy green vegetables. Try to avoid them, as well as avoid foods high in salt. Your canned soups, your deli meats, and any salt substitutes as well. Also avoid drinking alcohol with this medication. The last new medication you are starting is metformin. It is an anti-diabetic medicine, so it will help maintain your blood sugar. The most common side effect is typically like a GI irritation, bloating, diarrhea, nausea, etc. But this medication can also decrease your vitamin B2 levels. So, again, do not stop taking this medication abruptly. Call your PCP or your primary care physician if the GI effects are not able to be tolerated by you. But do not just stop taking it. The medication should be used in combination with diet and exercise. So be sure you're, getting your exercise regimen in and following a proper diabetic diet. You're also going to need to monitor your blood sugar daily, if not more frequently, to determine if it's too high, too low, and keep a record of this to give to your primary care doctor. Your A1C, that's a test to determine the average blood sugar over a few months. That's going to have to be checked regularly. This ensures that your blood sugar is controlled and they don't need to up or lower a dose. Do not skip these appointments. They are essential to keeping you healthy. With this medication and with being diabetic, it's important to know and recognize signs and symptoms of high blood sugar and low blood sugar. With low blood sugar, you will have shakiness, sweating, dizziness, extra hunger. You might feel really irritable. Some can experience a headache, confusion, weakness. Those are things that you need to recognize and be sure to promptly let your PCP know or go to an emergency department. A way to help with low blood sugar is hard candies, orange juice, apple juice. With high blood sugar, you want to be aware of tiredness, weakness, nausea, vomiting, blurred vision, frequency in urination, a whole lot of urinating, and also being very, very thirsty. Again, if these things occur, you need to contact your doctor promptly and or go to the emergency department. And finally, I just want to reiterate that it's important for you to take all of your medications how the doctor has them prescribed. If you start any over-the-counter medications, vitamins and or herbs of any kind, you want to let your doctor know prior to taking them so you can avoid any interactions that occur. Also, you need to be sure to follow through with appointments and any scheduled blood work, as that's essential to keeping you healthy and keeping your blood sugars and all your other levels where they need to be.